Okay. Let me. Yeah, of course. I'm a romantic guy, huh? So I love this guy. As I told you, maybe I will check by WhatsApp with someone of you regarding how to reach immediately this kind of lectures in your smartphone, right? In order to have with you every day what we saw, right? Because it's quite difficult the first time to be good, to understand everything, okay? We saw yesterday and the day before something regarding the surgery, the prosthesis, and tomorrow we will spend so much time for the soft tissue, right? Is the secret in anterior area to be predictable. Yesterday we saw a story of that girl. Now another girl, unlucky girl. Can you close the door, please? What is this kind of pictures? This is stupid guy that keeps in his head the time. Okay, this is a story of the time to be saved, and the message is to be patient, because if you want to be predictable, you cannot go fast. Okay, these are the contents. You have to be in your have in your hands the contents, and you have to study, as I told you. If you don't have the contents, you cannot guide your hands. And this is another important thing, the passion. Because without passion, you cannot do anything, and you cannot feel the course that you do with your passion. And this is a story of a passion. I lived this story during my trip in China, and I will tell you why, and I will show you why. Because I teach in Shanghai University, and so while I was traveling and coming back and traveling and coming back, I was treating this girl. So. And this is my message. Anything is possible, but you have to be able to follow this claim, right? So it's a huge amount of little things you have to follow. So this is she. Her name is Roberta. And she is not like that now, huh? In 99, 25? Yeah, 25 years, maybe. She was like that. She was an unlucky girl. She underwent in my department of orthodontic. And she was like that. She had a labiopalatal interruption, the cleft here. And she was like that. These pictures are not from me, huh? Are from 25 years. And you will see, as I told you, the difference in the digital dental photography. You will see the improvement of the quality during the lecture, right? This is not good picture. This is not emotional. This is not precise. Huh? It's not three-dimensional. It's only shooting, boom, with the ring. You have to shoot pictures with the lateral flash in order to create the three-dimensional effect. Yeah, yeah, of course. And she was like that. I am not orthodontist. I don't understand anything, maybe. But I understand that this girl is in trouble, right? The second massive treatment for her, 2001, she was like that. We can see, I am not so expert in orthodontics, but I am good enough to understand that something is not so good in the relationship with this girl. And some asymmetry is present here, right? And, oh, sorry. And this is the pictures that the colleagues sent me to describe the course of this girl. 2004. Can you imagine? 2004 is 9 years of suffering for this girl. 9 years. And the first massive surgery for the treatment of labiopalatal interruption. And 9 years of orthodontist. I can suffer after 9 days of orthodontist, right? But the time was passing by, and the treatment 2007, and some surprises were rising. Some asymmetry. This is the central line, but oh wow, there is a central incisor here. And where is the canine? And the lateral too? This is the situation in 2009. And this is the central, okay? Oh, the canine, finally the canine. But where is the lateral? And what is the position of this central incisor? It's crazy. It's like a joke. It's like a throw in the teeth, casually. And this is before the second massive surgery. Situation in the lower jaw was getting better, maybe, and maybe also in the upper. The lateral is missing, but before the second maxillofacial surgery, an inversion of the teeth relationship should be obtained in order to skip and go in a first class, right? 2011, after 16, 14 years of treatment. Wow. This girl is like a saint, in my opinion. And she always say, okay, doctor, don't worry, take your time. Always. It's crazy. And this is the situation. And also, for me, could be quite interesting. This is the asthma. This inclination of this lateral incisor, this not completely erupted canine. Some information is getting out. Good morning. I didn't recognize you before. Good morning, madam. And 7 years ago, now 8, she was a young girl. Right? And what girls want? Also men. Also the guys. Yeah. She wanna have a normal life. She wanna go out with friends. She wanna go out for a beer or something like that. Okay? Nothing more. But she was like that. And she was suffering for this situation now, after 23 years of treatment. And this is the situation after the second massive maxillofacial surgery. Okay, I know exactly what I should do, maybe. but I didn't knew this kind of girl yet. This was the situation. I want to skip very quickly. Okay. Now this girl wants something more. 2017. Because, and she's like that. She's so sad. Whoa. And I asked, the first time I saw this girl, I asked, okay, why you are here like that? Okay, why you are so sad? Doctor, man, can I have your attention? Yes? Yeah, yours. Okay. Don't disturb me. Go out or go stay in. Okay. Okay. This was one of the most important moments of my career, in which she said, okay, doctor, they say like that. You cannot smile normally anymore. You have to accept your diastema in the second, in a maxillary area. What is the problem, girl? Yeah, okay. Ask me so I can stop myself and you can translate. Take your time. Take your time, but with everyone. It's okay or not? The last sentences. Oh, the last sentences. They said, okay, you cannot smile anymore normally.
كانت عم تقول المريضة إنه أنا ما قادرة أبتسم مرة تانية بشكل عادي.
And they say to accept their diastema, the spaces, the black holes.
هو. فقال لها إنه لازم تقبلي الدياستما أو المسافات بين السنية الموجودة عندنا.
So you can see it cannot be beautiful anymore. Forget to have a good smile.
انسي إنه يكون عندك ابتسامة جميلة.
Okay, and this was very important for me because it was like a challenge.
كان تحدي.
And I said, okay, I think that you can smile in the next future.
قال لها إنه أنا إنه ممكن تبتسمي بالمستقبل.
And in 2019, she came to me. Okay, she came to, and she was introduced. First I listened to her. As I told you. I listened to her. And the second, secondly, what do you think you have to do?
شو برأيكم لازم نعمل أو شو لازم نعمل نحن نستمع للمريض؟
What do you do? Yeah, I don't understand Arab. Please in English. I'm not so well trained, but give me 2 months, okay? No, I'm joking. Yeah, what is the treatment plan? What treatment plan? What is blah 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 blah? What is? What is treatment plan? Take a picture. Wow, love this guy. And after? The mock-up. Whoa, wow! You don't need me anymore. You don't need me anymore. I'm so happy because when I speak with someone, I'm not. I don't want to say so many things. Few things, but extremely clear. Okay? Few things, but extremely clear. Forever. And I'm so glad that you answered so good. So, this is something for you for your next course in photography. Can you see the difference?
شفت الفرق بالصور؟
Yeah, because I use some lateral lights, right? And so a three-dimensional effect can be obtained.
استخدم أضواء جانبية طبعا.
So first, photography, as my colleague said. And I can see, okay, of course, there is the adhesions here, there is a gap, and there is the adhesions. There are some diastema, and yeah, of course. Additionally, and can you see how flat and how reduced in the vertical dimension these teeth are? So complex. If I have to close these spaces, I need to increase the horizontal volume. Oh, and the teeth could be super fat. Yeah, super wider. And this is a game of compromises in the proportion that you have to do with your dental technician, where you create the mock-up and the dental waxes, okay? The mock-up is the result of the waxes. So, when they say you have to put an implant, when you have another rule, please forgive, if not I kill you, okay? I kill you. You don't have to forget this. When a tooth is missing, 99.9999999% there is the need to increase with an horizontal or vertical or combined guided bone regeneration. If you want to be perfect, if you want to be normal, okay. If you want to be normal, put some fixture in some bone and whatever, okay. But we are not here to whatever, okay. Okay, sorry.
سن واحد فيه 99.9 لازم يكون او تتم عمليه اعاده تشكيل العصب الموجه تمام بشكل افقي وتدريسي لسان. عمودي او افقي او تدريسي لسان.
Do you agree, my friend? Okay. Now today we have a controller, right? He's checking. Okay. So this is the situation. Could you see the difference? How this picture can communicate if compared to these confusing images of the beginning? Because it's not a question of style or fashion. It's a question of how this picture can communicate to you, to your dental technician, to the audience, to your patient. It's a completely different story. And so, this is me after I told her, okay, I can help you. I can help you. Please, try to smile.
لأني بدي ساعدك. ففيني خليك تبتسمي.
And why she was finally smiling after so many times. You are in late, so take your seat. Why? Because was the first time she wore her new future smile with a mock-up. Can you see the addition, okay, here? So finally she said, oh, my teeth are without black holes. Wow. Wow, doctor, wow.
أسناني بدون فراغات سوداء.
But the situation is like that, okay. When I removed the tooth, oh, she was crying. And because this is the situation. And I need to create my treatment plan, step by step. Shush. I know, shush. Okay, first, I know three things. I know that. Sorry. The first, I need to put an implant like that. Okay, over there, and this is crystal clear. Okay, probably for sure I will do a GBR. Probably I will need an additional soft tissue graft as we will see tomorrow. But I'm not satisfied because I need to reshape all the gingival parabola as we saw yesterday. And so I can also gain the space in order to create a more balanced proportion between the horizontal and the vertical one. So I need to do a huge amount of things. And I need to go shui. Okay. Step by step. I prefer shui. So I go. This is another important issue. Probably, and we will see, this girl doesn't need too much bone around buccally because she has enough bone to surround the implant. But I need to increase buccally to eliminate the convexity and to create the symmetry with the contralateral area. You need?
هو بيحتاج انه يزيد من الناحية الدهليزية العظم تمام لحتى يحصل على الشكل الجمالي الكويس.
And so if you need to increase something, you need a good compromise between the releasing incisions and doing nothing. My recommendation, but is the recommendation of every consensus conferences in aesthetic area, is to create at least one releasing incision, the most distal you can, in order to have a good access for the bone, in order to increase. I did. It's very peculiar, this case, because in this case I did only this. After that, I usually do with my postgraduate. I do like that. I shift my place in the chair and say, okay, let's do this. This is what happened. I am generous, and he started raising the flap.
رفع الشريحة.
And immediately after 30 seconds of the surgery, I was, oh my God.
بعد 30 ثانية انصدم.
Can you see this? Oh my God. This is a partial, but important in my opinion, stretching of the soft tissue. Not so good. Yeah, not so good. But I was not so scared because probably I need to increase the vertical proportion. So I forgot to complain with my postgraduate. And
ما خاف كتير لأنه بده يزيد
you can see
الارتفاع العمودي.
Here there is another important issue. Even the palatal to buccal space is good enough for a narrow implant. Oh, let me 1, 2, 3. Okay, I have 7 millimeters, maybe, of space between the canine and the central incisor. 7 millimeters. What does it mean? It means that you have to forget the wide implants, the 4 millimeter implants in anterior area. the narrower you stay, the most space you save for your interproximal papilla. Because the literature clearly stated that 3.4, 3.5 millimeters are good enough to be stable and predictable in the mean to long term. So save space for your bone, for your interproximal spaces. In this case, this patient was enrolled in a protocol in which a 2.8 millimeter implant was used with a cone Morse. Do you know cone Morse? I know that you know, but not these guys.
Yeah. Explain that. They don't know.
They don't know. Okay. Do you know internal? Do you have two glasses? This is the glasses? No? Oh. Tomorrow. Okay. Tomorrow you will be the complete explanation. I give you a preview. Okay.
المسافات أنا ما يعني زهير.
excuse me. الأهم برأي الدكتور لوبس إنه نحن من بالمنطقة الأمامية نحط زرعة عريضة ونحط حتى نأمن ثبات عالي ونحط زرعة طويلة. المهم إنه نحن نأمن مسافة أفضل لحتى نأمن سبيسز للانتربروكسيمال بابيلا وهيك الانتربروكسيمال شوي interproximal papilla.
You have two glasses? Two glasses? Do you have two paper glasses? Two? No, glasses. Okay. Can you imagine two glasses? Okay, if you put two glasses, one internally to the other, maybe what happened? That they are fixed, right? Wow, I love you. Okay, like that. This is the internal conical connection. Okay. 5 degrees. Okay. Can you imagine?
5 درجات.
Okay. What's happened? Happened that there is some surface that is in perfect contact with the other one.
ممتاز أو مثالي.
And if these degrees are few till 3-4 degrees, you can have an additional connection named cone Morse. Is a perfect seal between two surfaces with a very few angle of connection. And if you reach this kind of seal, you are not in need to screw the abutment to the fixture, because this kind of seal is, by a mechanical point of view, so efficient that no movement will occur. Please.
طبعا هون إذا كان دائما الزاوية أقل بين الزرعة وهذه منطقة الختم اللي نحن عم نعملها هي دائما بتكون أفضل وبتقدر أنت تحصل على ختم أفضل. وشو كمان كان في تعليقات أستاذنا إذا بتضيفها؟
التيبر مورس تكنيك هو نفس التكنيك اللي بنستخدمه لما بعصوا الكاسات في بعضهم. لما بعصوا الكاسات في بعضهم ما في قوة بتقدر تمزع الدعامة عن المورس تكنيك هذا اللي جوا. هي التقنية بغض النظر عن ترجمة أول ما بايكون شركة بايكون هي اللي عملتها بالشورتي اند فاتي. Do you know that?
Of course.
Of course, American
Baikon.
Yes.
Of
Shorty
course.
and fatty they made this technique.
non ce la faccio.
الجلاسز مع بعضهم ما بنقدر نفكهم الا بحركه افقيه. هذا هو المبدا. في علاقه بين الدرجه والعمق هذا بالتيبر مورس حتى نحصل على ثبات وسيلينج ختم جيد لحواف الزرع عشان نأمن ثبات ونأمن الانتي بكتيريال افكتس.
Of course, because the seal, as I show you the first day, is perfect. No passing through of toxins and bacteria. So we go very quickly because they say, okay, go yalla yalla, they say. Oh, this is very important. I don't mind I am in late. Go back. What is this? Yeah, is this a guided surgery? Is this a super technological guided surgery template? No. Is a template is a very normal plastic template in which I ask to my dental technician, please, can you give me the information on the first burr placement? Please, can you tell me where you want that my implant should be with the first burr? What is the reason why? I have the technology to give a treatment plan digital. Why I didn't do this? I didn't do this for two reasons. The first, that in my end, when I have the perfect position of the drill, of the first drill, I can manage the inclination of the palatal to buccal inclination of my fixture first. But the second is this story. Do you know what this food is? I told you I was in China during that period. This is a crab noodle fantastic soup. It's wow, amazing. And why this soup is on the screen? Because when I was at the restaurant, I thought, wow, it's amazing, super taste. And how you cook this plate? How you cook this food? And he said, it was Chinese, super. He said, this is so special because it's a perfect balance between the male crab and the female crab. Like in maybe in the life. So I have to be balanced with this girl. Do you remember how many X-ray this girl had? How many?
كان لازم يحقق التوازن مع هاي المريضة.
Did I need additional information to know that I have to put an implant there? No, because I am perfectly able to do a GPR. So what is the benefit for me of an additional CBCT?
شو الفائدة من صورة تصوير مقطع؟
In this case. So use your brain and don't standardize every time. Every patient is special. Right? How many X-ray how many exposure this girl had? So I decided to go analogic. And also the cost for this girl to prepare the digital treatment plan, okay? You have to balance every time. So I go very quick, is a normal implant placement, but what is important? The inclination. In this case, I was also in the chance to use whatever I want, because no screw, no cement, but cone Morse effect I have to contain and go very quick. It's not important. The implant placement is not important. It's not important. It's not important. This is important for the inclination, because I know perfectly that the interproximal space is saved. Even my postgraduate did this stretching of the soft tissue, but he is still alive, right? So we provided for the GPR, okay? Very simple. In order to correct here, you know that the screw is completely in the native bone. It's not a problem of implant placement. It's a problem of soft tissue and GBR. So go.
ما كانت بالزرعة. كانت بالنسج الرخوي وإعادة تشكيل العظم.
Of course, here will be a damage, and I will have to correct with the second surgery. Of course. And this is the healing phases. The surgical re-entry 3 months. It's enough for the hard and soft tissue. I prepare for a connective tissue graft in order to increase that volume. And I want to provide it to recontour all the premaxillary soft tissue emergence profile. And this is what I did with my soft tissue. I tried to correct as a perioplastic surgery for the recession, the same approach. And this is what we obtain. But I want to go on. This is the sign of a soft tissue graft. And could you please consider, oh, finally we get the convexity. Okay, I have a huge amount of soft tissue. But it's not enough. It's never enough. It's never enough. This is the soft tissue. Tomorrow we will see how to do this. With the graphs, with the 3D animation, and with the clinical intervention. I think actually is the difference between a good and complete professional or not is if he or she is able to manage the soft tissues. Soft tissues is the key. Is the key because you can compensate nearly any defect in this way. Tomorrow you will see this kind of intervention. It's so delicate. I love this kind of surgery because it's so delicate, so soft. You need to be very gentle. And you cannot do this with the blade like that, right? Like the space. It's impossible. You have to use the appropriate instrument, right? So we provided with some soft ear additional with some hard tissue ear in order to create the best condition before the recontouring. The before and after. But we did anything still because there is some space here, space. Wow, it's like a mess still. And we provide for the provisional because when I take, as I show you, when I take the definitive impression, I need to give the patient the chance to go home and wait for the definitive. So I need a provisional now. So I need to take the impression before. And can you see how clear is this picture in order to explain something? So shoot the picture right. I don't love that kind of picture like that, okay? That you have to use the telescope to find something, okay? And this is mock-up, waxes, plastic guide for the recontouring. It's very easy. This is the blade. Also my 5-year-old baby can do that. Okay? And wait for, can you see? Finally, this first premolar was released by the soft tissues. released. In this case, there was no problem of the hard tissue assess. It was only an overgrowth of soft tissue. But you have to diagnose this with both the probe and the X-ray. And go on. And this is the S-line contour, as I told you. The story is always the same. Leave space here. S-line, you know? I told you. Huh? Space here for the soft tissue and compression here at the level of the emergence profile. The story is always the same. I am a simple guy. Few things, but very clear. Okay, let's go to the day of the definitive. I want to go faster. If not, my partner is shooting me. 2 months of soft tissue healing, and the months are more and more and more and more and more. And the impression were from the definitive fixture, implant support and reconstruction, and the veneer. For the reduction of the animal, we have always, by considering the vexes, we can have this siliconic guide that in 3D they can guide us. Please, you need to tell.
Okay.
Okay.
I'll go with you. Okay.
Okay. So, can you see? Not remove, no. Just a little bit. A huge, no, no, no. Just a little bit, huge. It's very simple. So, when you will do your next course of laminate veneer, and they say, oh, you have to prepare a 1 millimeter, half a millimeter. You take your bag and go like that and say, bye-bye, 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 stupid guy. Okay? Because there's no answer for that. The answer is the patient. And is the how able is your dental technician to create a non-invasive reconstruction. My reconstruction are 0.3 millimeter. So I don't need to do almost anything the most of the time. So this is the mock-up. The impression, okay. The impression. And finally, go to the dental technician. In this case, you can also go for digital, no problem. The important is that no defect in the impression to see the final cut, the final line of the preparation. Okay, and finally she can go out for the first time in her life with something without the black holes. Do you remember this girl before? And the dental technician that is the real main actor in our job. The main actor is not us, is not me, is my dental technician. He is the protagonist. He is the showman. Without a good dental technician, you can do anything. So spend money for your dental technician. Spend money, because it's the best investment for you. And so we go for the definitive, very quick. But it's important is the storytelling for you. And this is, of course, a compromise between the vertical and horizontal spaces. It's, of course, a compromise. But can you imagine how, where this girl started? And this is the day of the definitive reconstruction cementation, after the removal of the mock-up, very quick. Oh, and finally the definitive. Oh, do you remember that spaces? Where are the spaces?
ذكروا المسافات.
There's no
وين راحت
spaces
المسافة؟
now. And also we try to compensate just a little bit more also the shifting of the midline. Okay? In order
مساحة الخط المتوسط.
to joke, to play with the midline between the two central incisors.
مساحة الخط المتوسط بين الثنايا الأمامية.
She was like that, huh? If you don't remember. And this is the story of this girl. And this girl, do you remember? Whoa, that sad girl. Now she can smile, and she can go out with the friends. I know she cannot be a model. I know, but my job is to give her a smile.
بيعرف إنه ما راح تصير عارضة أزياء، تمام؟ لكن عطاها أحسن شيء عنده.
So, let's summarize how many months we take. 8 months. So the message is take your time. Take your time.
8 أشهر. الرسالة هي إنك تأخذ وقتك أثناء العمل.
And this is the control of this girl 1 year after the definitive.
بعد سنة.
And she's so self-confident. We gave her the self-confidence. It's amazing. And she was crying, and I have to be honest, I was just a little bit crying, and also me, because it was touching me. Her parents say, "Oh, thank you! You changed the life of my daughter." It's amazing. Again, every day I talk with you, I finish with, "Okay, this job is the best in the world." And again, I can tell you. Again, I can tell you. And tomorrow for the soft tissue, okay? I truly don't know when, but I give you information about.
Dr. Poulos, can I ask you a question?
You have to.
Yes. First of all, I think this case, she need a gingivectomy in the right side.
Mm-hmm.
Do you accept that?
In the right side,
The
where?
right side, yes. We have asymmetrically
Yes.
smile. If you make that.
I go back.
Yes, go back. Yes, yes, yes. The last one. Before. The next. Next. Next, please. Okay. Can you see here the right side and the left side is equal? I will ask the audience. Yes, yes, yes. So this is the first notice for me.
Mm-hmm.
Okay, can you give us the next one? The next slide, please. The next slide. The next one. Yes, yes. This is a gummy smile. I need to correct that. Do you see that? You can correct that. Maybe you have a short lip. Maybe. But I think she need gingivectomy. Can you give us the next slide, please? The next one. I want to see the zenith on the implant side. Before
I
maybe.
don't know.
Do you know the zenith, the top of the gingiva? Yes, that. Do you see the top here in the implant side? You use S-line technique, and that is a very good technique in the provisional crown. But I don't gain a good gingival contour in the next and the right side.
Sorry, what is your?
Can
Can
give
you
us the
repeat?
picture?
No, can you repeat, please?
Zenith, do you know the zenith? Zenith.
I
is
know
the
what
top.
is the
yes,
zenith.
Okay. Where is the zenith in the implant side?
What?
You need to put it distally maybe or the midline. Where is it? We see a square contour. Square.
But
Yes.
I don't know where you want to go. I truly don't know. But
Surely. Okay.
I can tell you this. I can tell you this. I can answer in this way. Can you? Okay. I draw this line
Okay.
for the symmetry, right? Okay. I told you at the beginning.
Yes.
I know.
Yes. From the beginning, you use free craft from the palate. Okay.
Yes.
Connective craft.
Yes.
And use S-line and use temporary crown. And the final result, for me as a surgeon, I don't accept that. This is my opinion. You can accept or not. And my opinion, of course, always, I will make a lecture after you. You can stay and you can give me your idea or your opinion. In every implant situation, we have to take CBCT. CBCT is not big radiography, and I will show you that if you want. You have to be, not for to make the first pilot drilling, no, to see where is the occlusal we need. We use the crown down technique, and we study the crown before doing implant. Where is the crown? Where is the papilla? You have to put it, and then we cannot do that without CBCT. And especially in the orthodontic, in the mid-lateral tooth. In mid-lateral tooth, as my professor, my teacher, Dr. Jamal, know that we have the central and the canine. They are not going straight like that. A lot of times they're going like that. So we have to make torque technique, torque to. Many of times we have to make CBCT. For me, I do CBCT before implant and after implant. And this is my opinion. Thank you for your lecture. Thank you for, this is cleft palate. This is cleft palate, okay? You don't mention that. This is cleft palate.
I told at the beginning. Cleft.
Cleft palate.
I told.
Unilateral cleft palate technique.
Sorry?
Unilateral cleft palate technique. Do you have any surgery on the lip? Just
Yes.
cleft?
I described. If you saw,
Okay.
I described.
Okay. Thank you very much, and I hope so. I hope you will be together and you have surgery maybe today, maybe tomorrow.
Of course.
Thank you. شكرا لكم
Of
زملاء
course.
وراح أكون معكم بعد شوي مع المحاضرة.
Of course, it's beautiful when some people has different opinion. My opinion is still to refer to the conferences, to the consensus conferences, in which, unfortunately, but it's very interesting to have a different opinion. The CBCT is not mandatory, but it could be very interesting to share this kind of opinion. In the consensus conferences, if you consult regarding the aesthetics, I am a scientist and I need to follow the literature. But it's very interesting to share this kind of a different opinion. No problem. Sorry?